We want to showcase MobiCure to you. So MobiCure is a pretty complex patient 360 application that we built on top of Dynamics 365. We've leveraged the Healthcare Accelerator, and it was launched simultaneously with the Microsoft Cloud for Health. And as you can see, it has certain functional elements that are providing the patient 360-degree functionality. It has all the information that you would need about the patient. It has a practitioner view. It has a doctor view. It has a view for the doctor's aid, and I can see pretty much all aspects of that particular patient, the demographic information about him or her, the appointments that they might have, the interactions that they might have with the doctors in the past, and any kind of prescriptions or medication that they are on. Details for every appointment are available. Any kind of cases, any kind of immunization records, all this information is available through integration to the popular EHR or EMR applications like Cerner, Epic, Allscripts, and others. We also have the capability to do a variety of different things with the data with the patient data. In particular, have the capability to allow the patient to call into a call center or a doctor's office and book an appointment on behalf of them. So I can go into the appointments calendar. I can then look at what's available on the care team's calendar. So I can see who the care team is for that particular patient and then book an appointment with either one of the doctors on the care team, gain an understanding of what insurance he or she would be using, and then book an appointment. When I do that, I then have, let's see, I'm going to do that with Dr. Derek Shepard, and I'll select a date. Availability gets filtered out, so I see what the next time slot the doctor has. I'm going to look for evening slot, and I can book the appointment. I can provide a reason for that particular appointment. I've had a consistent mild headache for the last few days, not going away. And what I have now is the ability to actually look at that appointment calendar and conduct that teleconsult right from there. So as a doctor, I'm logged in and I can look at that patient. I can look at his or her vital stats and kind of start the consult. I have everything available about that patient to me on the right hand side, and I can start the consult. When I do that, I also am able to see any pre-consult information that the patient might have filled out, and look at his complaints and get his vitals and all that associated with that pre-consult will be available to me. I go about doing some analysis during the call with him. I get on a video call, get more information from the patient, and at this point, I could have a diagnosis based on what the patient is telling me, and I could say, there's a prescription that I need to give you for a particular medication, and that would do it. Otherwise, I could also prescribe a test. And that is really what this teleconsulting feature does within Dynamics. Now, I think we mentioned in the past that these features have accompanying mobile apps as well. So you could use this either through Dynamics or through the mobile apps. Regardless, the data will actually get stored in Dynamics, and any integration that needs to be done with the EHR would also go in with the EHR. Here, the doctor is basically prescribing what medication I would take, and at this point the prescription can go into the patient's mobile app or be sent to him or her via an email link, email secure link from a compliance standpoint that might be needed. So that is really what we have from a teleconsult standpoint from within Dynamics. However, what we also want to show you is all the other aspects that we have built into Dynamics. So MobiCure has a set of accompanying mobile apps, both for the patient and the doctor. And as you can see here, I'm logged in into the patient app, and I can see a dashboard which provides the overview of what I have in terms of upcoming appointments, past appointments. I also have access to my test results that I might have had in the past, and access to my medication and my immunization records. So I could have prescriptions that are sort of ongoing prescriptions that are available to me, and I also have immunization records that are that I've had recorded here through the integration to the EHR. What I also have is the capability to look at the health summary and have direct access to my care team. I can also add in my family health records, so I can say, my dad was a diabetic, and that information is then available to the doctor to look at. In case he wants to determine if I have some predisposition to a particular disease because of the genetic makeup. I can schedule a call or a video consult or a in-person meeting with the doctor, and this can be, I'm doing this here with my care team. I can basically do that with another doctor if I wanted to, and find a doctor and figure out what time he or she has available. But let's say in this case I'm going to Dr. Labor for a video visit. I'll select the 12th of Feb as a date, and based on this time I will book the appointment. Once I book the appointment, I basically have the capability to have that appointment be saved to my calendar. Of course, the app is going to send me push notifications when the time comes for that particular appointment. What we are going to do next is walk through the actual appointment. So we're going to pretend that this was for right now, and do a teleconsult appointment. I'll say join the consult. When I do that, it basically starts the interaction with the system, and starts the interaction for the app. It gives me a pre-consult form, which basically asks me a configurable set of questions, and the reason why I'm trying to consult with the doctor. And this all information goes to the doctor. He or she can then look at this information and say he's ready to start consult. Once he has reviewed it, once he starts consult, he sends me a text message saying he's ready, and I do the same. And at that point, we can initiate a video call. So as you'll see, I'll get a call as soon as I say I'm ready to get started. So when I do that, the video call is actually a pretty immersive, high quality call that I can have with the doctor. I can showcase certain things. If if I've got some peripheral conditions, I can showcase a skin condition, or showcase my eye or something of that sort. And then at the end of the call, I have the capability to provide some feedback. When I do that, during the call, anything that the doctor might have done in terms of filling out a case sheet, he can prescribe a new medication or prescribe a new test for me. I can look at that prescription right in the mobile app, and if there was integration, I could send that to a pharmacy of my choice, or the doctor could have done it themselves, and the prescription could be viewable to me just for information purposes. And that's really the main piece of functionality here in the mobile app. In a short video, it's hard for us to depict all the features of MobiCure. However, we wanted to point out a couple of other interesting items that are not shown in the demonstration that you saw in the video. A couple of things that we've done, complex items like multi-resource scheduling. So in case surgery has to be scheduled and has associated elements that need to be scheduled, some are consumables, some are not. So it may be an operating room, surgeon's time, and associated elements with the staff, associated elements with consumables and machinery that might be required for that particular surgery. That is one. And second is we are doing some interesting IoT integration to capture health stats, and to be able to upload his health data such as sugar readings or blood pressure readings. In case you have more questions or need to reach us, please feel free to email us or call us. And the number and email address are shown above. Also, the solution that you've seen is all modular. Therefore, we can take elements of the solution and implement them or integrate them into your existing systems. Thank you.